Hello everyone, I am Mona Jane Mandam, and today I'll be discussing schizophrenia and its different types, including their signs and symptoms, treatment, and nursing interventions. So, first is to talk about what is schizophrenia. Schizophrenia is a chronic psychiatric disorder that affects how a person thinks, feels, and behaves. It is often characterized by episodes of psychosis, which include hallucinations, delusions, disorganized speech, and impaired social interactions. Individuals with schizophrenia may struggle to distinguish from reality from their own perceptions. Although the exact cause of schizophrenia is unknown, the research suggests that it is influenced by genetic factors, neurochemical imbalances, and environmental triggers such as stress, trauma, or substance abuse. This disorder typically emerge in late adolescence or early adulthood and require lifelong management through medications, therapy, and social support. The first type of schizophrenia is disorganized, which have signs and symptoms is characterized by the disorganized thinking, speech, and behavior, and patients may exhibit inappropriate emotional responses such as laughing at serious situations or showing a lack of facial expressions, and they often struggle with daily tasks like hygiene and meal preparations. For treatment, antipsychotic medication is given such as haloperidol are most prescribed or recommended, and psychotherapy and structured daily routine are also essential in managing the symptoms. For the nursing intervention, we should use a simple and clear communication to help the patient understand the instructions. And we should also provide a structured environment to reduce confusion and anxiety. And lastly, is we should assess with activities of daily living like bathing and dressing. And the second type is catatonic schizophrenia, which have the signs and symptoms involves extreme disturbance in movement, and patient may remain in rigid, motionless posture for long periods or exhibit excessive motor activity without purpose. And other symptoms include echolalia or repeating words and echoprasia or mimicking movements. And for treatment, in addition to antipsychotic medication, benzodiazepine like lorazepam may be used to reduce catatonia. In severe cases, electroconvulsive therapy may be considered, and for the nursing interventions, we should ensure the patient's safety by preventing injury due to immobility or excessive movement, and encourage gentle movements and physical activity to prevent complications like muscle stiffness. And also, we should monitor for nutritional and hydration needs as patients may refuse to eat or drink. The signs and symptoms include intense delusions and auditory hallucinations. The patient may believe they are being watched, followed, or conspired against, leading to suspicious and withdrawal from others, and they may also exhibit anxiety and aggressions when confronted with their delusions. For treatment, antipsychotics such as Clozapine are used to manage symptoms. Cognitive behavioral therapy can help patients challenge and cope with delusions. And also, visual supportive therapy is also beneficial. For nursing interventions, should avoid arguing about delusions, maintain a calm and non-threatening approach to reduce agitations, and encourage social interactions in a safe and controlled environment. Signs and symptoms diagnosed when a patient has a past episodes of schizophrenia but currently exhibit only mild or less frequently symptoms. This individual may have difficulty with emotional expression, social withdrawal, and impaired daily functioning. For treatment, long-term management with antipsychotic, psychotherapy, and social rehabilitation program is key to maintaining stability. For nursing interventions, encourage medication adherence to prevent relapse, promote social engagement through group therapy or structured activities, and you should provide supportive counseling to help the patient manage daily challenges. Next is we have undifferentiated schizophrenia. This type includes mixed symptoms that do not fit into a specific category. The signs and symptoms may patient experience a combination of delusions, hallucinations, disorganized speech, and emotional disturbances. For treatment, a combination of antipsychotic, psychotherapy, and social support help in managing symptoms. For the nursing interventions, we should monitor for symptoms progression and adjust care accordingly. And we should reinforce the reality orientation by engaging the patient in structured conversations and encourage participation in rehabilitation programs to improve social skills and independence. Schizophreniform disorder is similar to schizophrenia but lasts for a shorter duration. It's typically between 1 to 6 months. If symptoms persist beyond 6 months, the diagnosis may be changed to schizophrenia. The signs and symptoms are hallucinations and illusions, disorganized speech and behavior, impaired social or occupational functioning, and for treatment, antipsychotic medication, cognitive behavioral therapy to help manage through patterns, supportive therapy, and psychoeducation. For nursing intervention, we should monitor for psychotic symptoms and medication adherence, provide a structured and low-stress environment, educate family members about the short-term nature of the disorder and coping strategies. Next is we have schizoaffective disorder. Schizoaffective disorder is a combination of schizophrenia and mood disorder, and patients experience psychotic symptoms alongside mood disturbances. The signs and symptoms are hallucinations and delusions, period of severe depression or mania, disorganized thinking, and behavior social withdrawal. And for treatment, antipsychotics such as clozapine, mood stabilizer like lithium for bipolar symptoms, antidepressant or psychotherapy for mood regulation. And for nursing interventions, assess mood fluctuations and psychotic symptoms, provide emotional support and crisis interventions, and We should encourage adherence to both antipsychotic and mood-stabilizing medications. Next is we have delusional disorder. Delusional disorder is characterized by persistent, well-formed delusion lasting at least 1 month. Unlike schizophrenia, these individuals do not experience significant hallucinations or severe functional impairments. For the signs and symptoms, a strongly held false belief that persists despite evidence, lack of hallucination or very minimal, generally normal behavior outside of the delusional belief, and may exhibit paranoia or grandiosity. For treatment, antipsychotic medication like haloperidol, psychotherapy, particularly cognitive therapy to challenge the delusion, then supportive therapy for social functioning. And for the nursing intervention, do not challenge delusion directly. Instead, acknowledge the feelings, encourage reality-based thinking and conversations, promote social interaction to prevent isolations. Brief psychotic disorder, which is this disorder is characterized by a sudden onset of psychotic symptoms that last from 1 day to 1 month, after which the person returns to normal functioning. The signs and symptoms are hallucination and delusions, disorganized speech and behavior, severe emotional distress or confusion, and sudden onset or being often triggered by stress or trauma. For treatment, short-term antipsychotic medication if needed, and also you have psychotherapy to address stress-related triggers, and supportive care and monitoring for recurrence. And for the nursing intervention, we should provide a calm and safe environment. We should offer emotional support and reassurance, monitor for risks of self-harm or harm to others. Shared psychotic disorder, which is it occurs when two or more people share the same delusion, and it is usually one person or the primary individual has a psychotic disorder and the other adapt their beliefs. The signs and symptoms are if the one person transmits the delusional beliefs to another, and the secondary person accepts and reinforces the delusions. Social isolation also one sign of symptoms, and it is often limited to the relationship with the primary persons. And for treatment, separating the individuals to break the reinforcement of delusions. And also we have antipsychotic treatment for the primary affected person, and psychotherapy and family counseling. For the nursing intervention, we should encourage independence from the primary delusional individual, and also should provide reality-based conversation and alternative viewpoints, and we should also offer support to family members. Fetal alcohol syndrome is a condition that occurs in babies due to alcohol consumption by the mother during pregnancy. Alcohol causes the placenta, and it affects the fetal development and causing the permanent physical, neurological, and behavioral abnormalities. And it is part of a broader group known as a fetal alcohol spectrum disorder, but possesses the most severe form, since alcohol is directly interferes with fetal growth, and there is no known safe amount or time to consume alcohol during pregnancy. Even small amount can cause harm. And for the signs and symptoms of fetal alcohol syndrome, it affects multiple body systems, including the physical appearance, cognitive functions, and behavior. And this can be categorized as follows. The physical features niya ay na siya ay small head, circumference, and thin upper lip or small widely spaced eyes, then lower width and short stature. And for the neurological and cognitive deficits, the intellectual disability and learning difficulties, the shy for memory and attention span, speech and language delays. And for the behavioral and social problems, hyperactive and impulsivity, difficulty following rules and instructions, and poor social skills and trouble understanding consequences, and also it increases the risk of mental health disorder such as anxiety and depressions. Attention deficit hyperactivity disorder is a chronic condition characterized by inattention, hyperactivity, and impulsivity that interfere with daily functioning and development, and it commonly begins in childhood and may continue into adulthood. ADHD is caused by a combination of genetic, neurological, and environmental factors affecting the brain area that is responsible for attention, impulse control, and executive function. Individuals with ADHD often struggle with focus, organization, and impulse control, and making academic, social, and work environment challenging. For the signs and symptoms, it varies from person to person and are categorized into three main types, which are inattentive type. Second is we have hyperactive impulsive type, and third is combined type. So for the inattentive type, it is easily distracted and struggle to stay focused, and forgetful and frequently lost items. And for hyperactive impulsive type, it's talk excessively and interrupt conversation, and constant fidgeting or restlessness. And for combined type, display both initiative and hyperactive impulsive symptoms. And for the treatment for ADHD, it typically involves a combination of medication, behavioral therapy, and lifestyle changes. For the nursing intervention, we should identify the triggers that worsen hyperactivity or inattention. Autism spectrum disorder is a lifelong neurodevelopmental condition characterized by difficulties in social interactions, communication, and repetitive behavior. And it is called spectrum disorder because symptoms and severity vary widely among individuals. And ASD is believed to be caused by a combination of genetic and environmental factors affecting brain development, and it is typically diagnosed in early childhood and affect both the children and adults, and it is dependent on the severity of the conditions. And there are types of autism spectrum disorder. So first is we have the level 1, which is the mild, which is require support, but it is difficult with social cues and communication, but has average or above average intelligence, and it may struggle with rigid routines and sensory sensitivities. And next is we have the level 2, which is moderate. It's requiring substantial support, which is more significant social and communication difficulties, and need structured support to function in daily life. And last is we have the level 3, which is muna siya ang pinaka-severe, and it is extreme difficult adapting to change. And for the signs and symptoms of ASD, the symptoms is mag-vary siya but are generally grouped into two main categories, which is the social, communication, and repetitive behavior and restricted interest. So, social and communication difficulties such as delayed speech or nonverbal communication, difficulty understanding facial expression and social cues, and for the repetitive behavior and restricted interest, which have kaning strict adherence to routines and distress when disrupted, and intense focus on a specific interests like memorizing trained schedules and numbers. For the treatment of ASD, there is no cure for ASD, but early intervention and therapy can significantly improve the communication and behavior. And for the medication, antipsychotics like risperidone, and for the nursing intervention, as a nurse, our role in ASD management focus only in early detection, education, and providing a structured and supportive environment. Like we use a simple, clear instruction and visual aids. Neurodevelopmental disorder characterized by significant limitation and intellectual functioning, IQ below 70, and adaptive behaviors such as communication, social skills, and daily living activities. These limitations occur before the age of 18 and impact an individual's ability to function independently in daily life. The severity of intellectual varies from mild to profound. Causes of intellectual disability can result from various factors including genetic causes, maternal infections, alcohol or drug use during pregnancy, premature birth or low birth weight, severe malnutrition, head trauma, or brain injury. And for the signs and symptoms, delayed speech and language development, struggle with problem solving and learning new skills, difficulty with self-care tasks like dressing, eating, and hygiene, and also poor social and communication skills. Then for the management and treatment, so although ID is a lifelong condition and various intervention can improve quality of life and enhance independent functioning, speech education programs to improve learning skills, speech occupational therapy for communication and daily tasks. And for the nursing intervention, we should teach self-care skills using simple, repetitive interactions, and we should provide a safe and structured environment. For mild or moderate, the IQ is 50 to 70, and the signs and symptoms can learn basic skills, communicate well, and live independently with minimal support but struggles with problem solving. And for treatment, special education, speech therapy, and vocational training. And for the nursing intervention, we should encourage independence, teach self-care skills, and support structured learning. And with the moderate IQ of 35 to 50, and for the signs and symptoms, can learn simple communication and self-care with supervision but has limited academic ability. And for the treatment, special education, speech and occupational therapy, and life skills training. And for the nursing intervention, we should use simple instructions, provide emotional support, and encourage daily routine. And for the third, we have severe or the adult, which have IQ of 20 to 35. For the signs and symptoms, with minimal verbal communication, needs constant supervision, and can learn basic health tasks. And with the treatment, intensive therapy, full-time assistance, and medical care for associated conditions. And for the nursing intervention, we should ensure the safety, assess with daily activities, and educate caregivers. And for the last is we have profound IQ below 20, and the signs and symptoms is little to no communication, completely dependent on caregivers, and we have physical disabilities. And for the treatment, full-time care in a specialized facility and medical management for related conditions. And for the nursing intervention, we should provide total care and prevent complications like brain source and offer family support. Delirium is an acute and sudden disturbance in awareness, attention, and cognition, and it is usually caused by an underlying medical issues or substance use, and it is typically reversible with proper treatment. While dementia, on the other hand, is a chronic and progressive decline in memory, thinking, and daily function due to neurodegenerative diseases. Unlike delirium, dementia is reversible and worsen over time. Alzheimer's disease is a progressive neurodegenerative disorder that affects the memory, thinking, and behavior. It is the most common cause of dementia and primarily affecting older adults. The disease is characterized by the accumulation of abnormal protein deposits in the brain, including the beta-amyloid plaque, and which lead to the loss of neurons and brain function over time. The symptoms of Alzheimer's disease typically start with a mild memory loss and difficulty finding words, then progress to confusion, disorientation, difficulty completing daily tasks, personality changes, and in later stage, loss of the ability to communicate and perform basic functions. And there is no cure for Alzheimer's disease, but treatment like medication, lifestyle modifications, and supportive care can help manage symptoms and slow progressions. For the signs and symptoms of Alzheimer's disease, its progress in stage with symptoms worsening over time. In early stage, mild forgetfulness, such as forgetting recent conversation, difficulty finding words, and trouble with problem solving and planning. In middle stage, difficulty recognizing familiar people, and trouble performing daily activities such as dressing and talking. While in the late stage, severe memory loss, and inability to communicate effectively, of ability to walk, sit, or swallow. And for the treatment, there is no cure, but medication like donepezil and memantine help manage symptoms. And also therapy is a structured routine. The healthy lifestyle can slow progression and improve quality of life. And for the nursing intervention, we should ensure safety like prevent falls, monitor wandering, and support memory like use reminders, structured routines, and we should assess with daily activities like we help with dressing and eating. Pica is a disorder where a person persistently eats non-food substances like dirt and chalk for at least 1 month. Despite lacking nutritional value, it is common in children, pregnant women, and individuals with intellectual disabilities. For the signs and symptoms, cravings and eating non-food items, digestive problem like constipation, stomach pain, and also nutritional deficiencies and poisoning risk like lead poisoning. So for treatment, behavioral therapy to reduce cravings, nutritional counseling to address deficiencies, treatment for underlying conditions like iron deficiency anemia. For nursing interventions, we should monitor for ingestion of harmful substances. Then we should educate patients and caregivers on nutritional needs, and also we should provide a safe alternative behaviors to reduce cravings. Next is we have ruminations disorder, where is a condition where a person repeatedly regurgitates or rechews and swallow food or spits it out, lasting for at least 1 month. It is more common in infants, children, and individuals with developmental disabilities. For the signs and symptoms, repeated regurgitations without nausea, weight loss and malnutrition, and also bad breath and dental issues. For treatment, behavioral therapy like diaphragmatic breathing, nutritional support to prevent deficiencies, and addressing psychological factors like stress and anxiety. For the nursing intervention, we should monitor the weight and nutritional status, educate the caregiver on feeding techniques, and encourage a stress-free feeding environment. And next is we have anorexia nervosa, which is a disorder characterized by extreme food restrictions, fear of gaining weight, and distorted body image. It is common in adolescents, especially females, and for the signs and symptoms, severe weight loss and malnutrition, intense fear of gaining weight, excessive exercise and restrictive eating habits, amenorrhea or loss of intuition, weakness, hair thinning, and dry skin. For treatment, medical stabilization for malnutrition and dehydration, nutritional rehabilitation and meal planning, and cognitive behavioral therapy to improve body image, and medications like antidepressant if needed. For the nursing intervention, we should monitor the weight, vital signs, and electrolyte levels. We should encourage a healthy eating patterns, provide emotional support, and address distorted thoughts, and prevent excessive exercise and purging behaviors. Next is we have the bulimia nervosa, a disorder where individuals engage in binge eating followed by purging like vomiting, laxative, fasting, or excessive exercise to prevent weight gain. The signs and symptoms: binge eating followed by purging behavior, swollen chest from vomiting and damaged teeth, dehydration, electrolyte imbalances, and irregular heartbeat, and also feelings of guilt and shame after being episodes. For treatment, we have cognitive behavioral therapy to manage being purge cycles and nutritional counseling to develop normal eating pattern. For nursing intervention, we should monitor for purging behavior and electrolyte imbalances, educate on the dangers of binge purge cycles, and encourage healthy coping strategies for stress and body image concern. Next is we have the binge eating disorder, which is a condition where a person frequently consumes large amount of food in a short period, often feeling a loss of control but without purging. The signs and symptoms: eating large amount of food quickly even when not hungry, feelings of guilt, shame, and distress being, uh, after being weight gain and obesity-related health problems like diabetes and hypertension. For treatment, we have also the cognitive behavioral therapy to manage emotional triggers, nutritional counseling for portion control and mindful eating, and medication like SSRIs to reduce binge episodes. For the nursing intervention, we should encourage healthy eating habits and portion control, identify emotional triggers for binge eating, promote physical activity and weight management strategies. First, we discuss about the gender identity disorder, or called now as gender dysphoria, which is a condition where an individual experiences a significant distress due to a mismatch between their assigned sex at birth and their gender identity. For the signs and symptoms, first is a strong desire to be of the opposite gender, discomfort with one's biological sex, preference for clothing, rules, and activities of the identified gender, social withdrawal and depression due to the gender distress. And for treatment, psychological counseling and gender-affirming therapy, hormone therapy, and gender-affirming surgery if desired, support groups and family counseling also. For the nursing intervention, we should provide emotional support and a non-judgmental environment, educate the patient and families on gender dysphoria, and encourage self-expression and healthy coping strategies. Hypoactive sexual desire disorder, which is a persistent lack of sexual interest or desire, causing distress in relationship. For the signs and symptoms, low or no interest in sexual activity, absence of sexual thoughts or fantasies, relationship strain due to lack of intimacy. For treatment, psychotherapy like sex therapy, cognitive behavioral therapy, hormonal treatment like testosterone therapy if needed, and addressing underlying causes like stress, depression, or medical conditions. For the nursing intervention, we should assess emotional and psychological factors affecting the desire. We should encourage open communication between the partners, and we should educate on relaxation techniques and intimacy building activities. For the third, we have sexual aversion disorder, which is an intense fear or anxiety towards sexual activity leading to avoidance. For the signs and symptoms, panic, nausea, or extreme distress when faced with sexual situation, avoidance of intimacy or physical contact, and relationship difficulties. For treatment, cognitive behavioral therapy and exposure therapy is needed, sex therapy to address fears and misconception, medication for underlying anxiety or trauma. For the nursing interventions, we should create a supportive and non-judgmental space for discussion, encourage relaxation and gradual exposure therapy, and help the patient explore underlying causes like trauma or abuse. Next is we have the dyspareunia, which is the persistent pain during sexual intercourse in males or females. For the signs and symptoms, pain during or after sex, burning or sharp discomfort in the genital area, fear of sexual activity due to pain. For the treatment, we should treat the underlying infections, hormonal imbalances or physical condition, and also counseling for psychological causes like anxiety or past trauma. For the nursing intervention, we should assess the pain characteristics and medical history. We should educate on lubrication and relaxation technique and refer to specialists for pelvic floor therapy if needed. For the next is we have vaginismus, which is the involuntary contraction of vaginal muscles, making penetration difficult or painful. For the signs and symptoms, pain or inability to have intercourse, insert tampons or undergo pelvic exam, anxiety and fear of penetration, muscle spasm in the vaginal area also. For the treatment, pelvic floor therapy and desensitization exercise, use of vaginal dilators and relaxation techniques, and counseling to address psychological factors. For the nursing interventions, we should provide reassurance and education about the treatment option, encourage gradual desensitization with the dilators, and offer emotional support and therapy referrals. Premature ejaculation, which is occurs too quickly during sexual activity and causing distress. For the signs and symptoms, ejaculation within 1 minute of penetration, lack of control over ejaculation, and frustration and relationship strain. For treatment, behavioral techniques like start-stop method, squeeze technique, and sex therapy and counseling. For the nursing intervention, we should educate on behavioral techniques for better control, providing guidance on relaxation exercises, and encourage communication with a partner. Next is we have the female orgasmic dysfunction disorder. It is difficulty achieving orgasm despite adequate stimulation. For the signs and symptoms, delayed, infrequent, or absent orgasm, reduced sexual satisfaction, anxiety or frustration during intimacy. For treatment, sex therapy and behavioral interventions, sensate focus exercise to enhance pleasure, address underlying medical or psychological issues. For the nursing interventions, we should encourage open discussions about sexual health, provide educational on sexual response and stimulation, and refer for therapy if emotional distress is present. Next is we have the male orgasmic dysfunction or difficulty or inability to achieve orgasm despite adequate arousal. For the signs and symptoms, delayed or absent ejaculation, reduced sexual satisfaction, and psychological distress. For treatment, psychotherapy and sex therapy, medication to address underlying conditions, sensate focus and arousal technique. For the nursing intervention, we should assess the underlying physical or emotional causes, provide education and treatment option, and we should encourage self-exploration and intimacy technique. Next is we have the erectile dysfunction, which is inability to achieve or maintain an erection sufficient for sexual activity. For the signs and symptoms, difficulty getting or keeping an erection, reduced sexual confidence, anxiety or depression related to performance. For the treatment, lifestyle changes like exercise, healthy diet, and quitting smoking, and therapy for psychological causes. For the nursing intervention, we should educate on lifestyle changes and medication use, assess psychological and medical factors contributing, then encourage communication with a partner. And next is we have sexual addiction. This is a compulsive engagement in sexual behavior despite negative consequences. For the signs and symptoms, uncontrollable urges for sexual activities, neglect of responsibilities due to sexual behaviors, and relationship and social problems. For treatment, we have cognitive behavioral therapy, support groups like Sex Addict Anonymous, medication for impulse controls. And for the nursing intervention, we should provide emotional support without judgment, refer to counseling and support groups, and we should educate on health coping strategies. Next is we have exhibitionism, which is a disorder where individuals derive sexual pleasure from exposing their genitals to unsuspecting people. For the signs and symptoms, repeated urges of behavior of public exposure, sexual arousal from shocking or distressing others, and legal and social consequences. For treatment, cognitive behavioral therapy, medication like anti-androgens, and addressing the underlying psychological issues. For the nursing intervention, we should assess the risk factor and emotional distress. We should provide educational and impulse control strategies and refer for therapy and legal counseling if needed. Fetishism, which is a disorder where individuals experience intense sexual arousal from non-living objects like, example, shoes or underwear or body parts that not typically associated with sexual attraction. For the signs and symptoms, a strong sexual fixation on a specific object or body parts, then dependence on fetish for arousal and satisfaction, and distress or relationship problems. For treatment, we have cognitive behavioral therapy, psychotherapy to address distress and compulsions, and medication like SSRIs for impulse control. For the nursing intervention, we should provide non-judgmental support and education. We should encourage therapy for compulsive behavior and address social and emotional consequences. Next is we have the proteureurism, which is a disorder characterized by sexual arousal from rubbing against or touching a non-consenting person. For the signs and symptoms, engaging in unwanted physical contact in crowded places, recurrent sexual fantasies about rubbing against strangers, and distress or inability to control the urge. Then, for the treatment, we have cognitive behavioral therapy, medications like anti-androgens, legal intervention if necessary also. And for the nursing intervention, we should assess the risk of harm to others, provide therapy referrals for impulse control, and educate on legal and social consequences. Pedophilia, which is a disorder where an individual experiences sexual attraction toward prepubescent children. The signs and symptoms include recurrent fantasies involving children, attempting to engage or justify inappropriate behavior, feelings of guilt, shame, or distress. For treatment, we have cognitive behavioral therapy, medication like anti-androgens, and strict legal and legal monitoring. For the nursing intervention, we should mandatory reporting of abuse cases, referral to specialized therapy program, and educate on self-control strategies and ethical behavior. Next, we have the sexual masochism, which is a disorder wherein individual decide sexual pleasure from being humiliated, beaten, or made to suffer. For the signs and symptoms, engaging in or fantasizing about painful or degrading sexual activities, feeling of distress or impairment in daily life, and threats of physical harm from extreme behavior. For the treatment, we have the psychotherapy like CBT to address the distress, medications like SSRIs for impulse control, and also as we have behavioral therapy. For the nursing intervention, we should provide a non-judgmental space for discussions. We should assess for signs of self-harm or abuse, and we should educate on safe practice and risk management. Sexual sadism, which is a disorder where an individual experiences sexual pleasure from inflicting pain, suffering, or humiliation on others. For the signs and symptoms, recurrent fantasies or behaviors of causing pain to others, inability to achieve sexual satisfaction without sadistic act, and risk of harming others without consent. For the treatment, we have cognitive behavioral therapy. For the medication, we have anti-androgens and legal intervention also for non-counsel act. Then for the nursing intervention, we should assess for potential harm to others, refer for therapy and counseling services, and we should educate on ethical and consensual behavior. And next is we have transvectic fetishism, which is a disorder where individuals experience sexual arousal from dressing and clothing typically associated with the opposite gender. For the signs and symptoms, sexual excitement from cross-dressing, distress or impairment in social and occupational life, feeling of shame or secrecy about the behavior. For the treatment, psychotherapy to address distress and self-acceptance, counseling for partnership and family members also. For the nursing intervention, we should provide a supportive and non-judgmental environment, educate on self-acceptance and coping strategies, and refer to mental health services if distress is present. Next is we have the voyeurism, which is a disorder where individuals experience sexual arousal from secretly observing others who are naked or engage in sexual activities. And for the signs and symptoms, repeated urge spy in suspecting individuals, use of hidden cameras or other invasive means, distress or legal consequence from behavior. For the treatment, we have cognitive behavioral therapy, medications like anti-androgens, and legal consequence if acts are non-consensual. For the nursing intervention, we should educate on legal rights and ethical concern, provide referrals for therapy and impulse control programs, and assist for any existing psychological disorder. Next is we have the zoophilia, which is a disorder characterized by sexual attraction to animals. For the signs and symptoms, recurrent fantasies or behavior involving the animals, preference for animal-related sexual stimuli over human partner, and social isolation and distress. For treatment, cognitive behavioral therapy, medications like anti-androgens, and legal consequence in cases of animal abuse. For the nursing intervention, we should assess the risk factors for harmful behavior, refer to psychiatric and behavioral therapy, and we should educate on ethical and legal implications. And next is we have the necrophilia, which is a disorder where an individual experiences sexual attraction to corpses. For the signs and symptoms, fantasy fantasizing about or engaging in sexual act with the decades, avoidance of living human partners, and legal and social consequences. For treatment, we have intensive psychotherapy and behavioral medications. For the medication, we have also the anti-androgens and legal actions for criminal behavior. For the nursing intervention, we should immediate psychiatric evaluation and legal reporting if necessary, referral to mental health professionals, and educate on ethical and legal implications. Next is we have the coprophilia, which is a disorder where an individual desires sexual pleasure from faces. For the signs and symptoms, sexual arousal from touching, smelling, or consuming faces, and for risk for infection and hygiene-related health issues and social and relationship difficulties. For treatment, we have the CBT or the cognitive behavioral therapy. For the medication, we have the anti-androgens and the hygiene education and health monitoring also. For the nursing intervention, we should provide education in hygiene and health rest. This for therapy for compulsive behavior, and we should assess for underlying psychological disorder. Next is we have the urophilia, which is a disorder where individual derives sexual pleasure from urine. For the signs and symptoms, sexual excitement from urination-related activities, risk of infection or hygiene concerns, social embarrassment or secrecy. For the treatment, we have cognitive behavioral therapy, medication like exercise for impulse control, and hygiene counseling. For nursing intervention, we should provide non-judgmental education on health rest, encourage therapy for distressing behavior, and we should monitor for any co-occurring mental health conditions. And we have partialism, which is a disorder where an individual is sexually fixated on a specific body part like feet and hands. For the signs and symptoms, intense sexual attraction to a specific body part, difficulty achieving arousal without the fictitious body part, and social and relationship issues. For the treatment, we have cognitive behavioral therapy, sensate focused therapy to broaden sexual preferences, and medication like SSRIs for compulsive. Then for the nursing intervention, we should provide therapy referral for compulsive behavior, should encourage open discussion and healthy relationship, and we should educate on social and emotional impact. Then, next is we have the telephone eschatologia, which is a disorder where an individual gains sexual gratification from making absence phone calls. Then, for the signs and symptoms, recurrent urge to make sexual explicit call, the stress or legal consequence from the behavior, and social withdrawal and secrecy. For the treatment, we have cognitive behavioral therapy. For the medication, we have the SSRIs and anti-androgens, and legal consequence in cases of harassment. For the nursing intervention, educate on the impact of harassment on victims, should refer to therapy for impulse control disorder, and we should assess for any underlying mental health condition.